In looking at the branches of the abdominal aorta, we'll begin with the three which arise in the midline and supply the gastrointestinal organs. Then we'll look at the branches that arise in pairs. The three midline branches are the celiac trunk, the superior mesenteric, and the inferior mesenteric. The celiac trunk arises immediately below the margin of the aortic opening at the level of T12. It divides into three branches: the common hepatic, the left gastric, and the splenic. Between them, these supply the liver, stomach, duodenum, pancreas, and spleen. The superior mesenteric artery arises at the level of L1. Its branches supply the small intestine and much of the large intestine. The inferior mesenteric artery arises at the level of L3. Its branches supply the distal part of the large intestine. Of the branches of the aorta that arise in pairs, much the largest are the right and left renal arteries, which supply the kidneys. They arise just below the level of the superior mesenteric artery. Arising at about L2 are, in the female, the ovarian, and in the male, the testicular arteries, which run downward and laterally over the psoas muscle. 4 pairs of lumbar arteries arise from the back of the aorta. Here are the lower two. They pass behind psoas major, where they branch to supply the back, the spine, and the abdominal wall. Lastly, here's the median sacral artery, which arises from the back of the aorta just above the bifurcation and passes down into the pelvis. Next, we'll look at the common iliac arteries and at their branches. On each side, the common iliac divides into the internal and external iliac arteries. The common iliac artery runs close to the medial border of psoas major. It divides here at the pelvic brim. Here's the external iliac artery. Here's the internal. We'll look at the internal iliac in the next section. The external iliac artery is the main artery to the lower extremity. It runs along the pelvic brim just medial to psoas major and passes beneath the inguinal ligament. Below the inguinal ligament, the artery goes by a different name, the femoral artery. Just before passing beneath the ligament, the external iliac gives off 2 branches, the deep circumflex iliac laterally and the inferior epigastric medially. The inferior epigastric supplies the lower part of the abdominal wall. We'll see where it goes in a minute. But first, we'll add the principal veins of the abdominal region to the picture. We'll start down at the inguinal ligament. Here's the femoral vein, lying medial to the femoral artery as it passes beneath the inguinal ligament. Above the ligament, it's called the external iliac vein. The external iliac is joined by the internal iliac to form the common iliac vein. The 2 common iliacs join just to the right of the aortic bifurcation to form the inferior vena cava. The right common iliac artery passes in front of the left common iliac vein. The inferior vena cava runs just to the right of the midline. It lies on the vertebral bodies from L4 to T12, then on the left close of the diaphragm. It passes through the diaphragm here to enter the right atrium, as we saw in the last section. The 2 large renal veins join the inferior vena cava at the level of L2. This is the left testicular vein. The right one has been removed. There aren't any veins that directly correspond to the celiac trunk and the mesenteric arteries. The blood that goes out through those arteries comes back to the liver by way of the portal vein, as we'll see in volume 5 of this atlas. The blood from the liver then returns to the main circulation through these large hepatic veins. The hepatic veins are very short. Their number varies. Here there are 3. They enter the vena cava just below the diaphragm. Next, we'll look briefly at the main blood vessels of the anterior abdominal wall, the superior epigastric and inferior epigastric. We've seen that the inferior epigastric artery arises from the external iliac. The superior epigastric artery is the continuation of the internal thoracic. We saw it in the last section. In this dissection, the peritoneum and fascia on the inside of the lower part of the anterior abdominal wall have been removed. Here are the external iliac vessels. Here are the inferior epigastric artery and vein. They pass upward and medially and run up the back of the rectus abdominis muscle. They enter the rectus sheath by passing in front of the arcuate line. The superior epigastrics also lie behind the rectus abdominis. To see them, we've removed the upper part of the posterior rectus sheath. Here's the superior epigastric artery, emerging from behind the costal margin and passing down onto the back of the rectus. Its branches are anastomosed with those of the inferior epigastric within the rectus muscle. Now we'll move on to look briefly at the principal nerves of the abdominal region. First, we'll see the nerves that provide the motor and sensory supply to the lateral and anterior abdominal wall. These nerves are continuations of the lower intercostal nerves, from T7 downwards. Here are 4 of them. They emerge beneath the costal margin. Here's the 11th rib. Here's the start of the costal arch. The nerves run obliquely downwards and forwards in the plane between the transversus abdominis and internal oblique muscles. The external oblique has largely been removed in this dissection. Next, we'll look at the nerves of the posterior abdominal wall. Most of these are derived from the lumbar plexus, a complex joining and rebranching of the anterior primary rami from the 12th thoracic to the 5th lumbar segment. The lumbar plexus lies behind and within the psoas major muscle. The nerves that arise from the lumbar plexus emerge from beneath psoas major or through it. Here are the subcostal nerve, which comes from T12, the iliohypogastric and ilioinguinal nerves, the lateral cutaneous nerve of the thigh, and the genitofemoral nerve. Between them, these provide sensation to the inguinal region and to the anterior part of the upper thigh. Here are 2 major nerves of the lower extremity, the femoral nerve emerging lateral to psoas major, and the obturator nerve emerging medial to it. The femoral nerve runs alongside psoas major and passes beneath the inguinal ligament just lateral to the femoral artery. The obturator nerve runs just below the pelvic brim and enters the obturator canal. The femoral and obturator nerves are shown in more detail in Volume 2 of this atlas. Lastly, we'll look at the principal autonomic nerves of the abdomen, the vagus nerves, the sympathetic trunks, and the aortic plexus. Here's the aortic bifurcation. Here's the upper part of psoas major. Here's the right crus of the diaphragm. Here's the sympathetic trunk emerging through the edge of the diaphragm and running close to the vertebral bodies down toward the pelvis. Again, here's the right crus of the diaphragm. Here are the divided celiac trunk and superior mesenteric artery. This is a large sympathetic ganglion. It's connected to this smaller one and to several others that have been removed in this dissection. Together, they form the aortic plexus, which distributes sympathetic innervation to most of the abdominal viscera. To see the vagus nerves as they enter the abdominal cavity, we'll look at a dissection in which the stomach has been left intact. This is the stomach. Here's the esophagus. It comes through the diaphragm here. Here are 2 branches of the right vagus nerve, also passing through the esophageal hiatus. The branches of the left vagus are out of sight, around here. The vagus nerves break up into many smaller branches, which provide the parasympathetic supply to the stomach, the small and large intestines, and other abdominal organs.